There's an easy way to protect yourself and those you love from COVID-19. Get vaccinated.
Here's what we know about the vaccines.
They're safe. Serious side effects are extremely rare.
They have one job. They kick your immune system into gear, then they leave your body.
They're effective. They provide outstanding protection against serious illness.
Listen to the local doctors you trust.
Let's strive for a 75% vaccination rate.
Do your part.
Reconsider.
Get the shot.
Good morning. I want to welcome you to our press briefing with updates on COVID-19. Before we begin today, please join me in a moment of silence for the lives we've lost and for the families they leave behind. Thank you. We will now hear updates from our community leaders, and first we'll hear from Dougherty County Commission Chair Christopher Cohelis. Mr. Chair.
Thank you, Chief. Good morning, everyone. Don't have a lot to report today. But what I did want to do is give everyone an update regarding the progress in our Strive for 75 campaign. We recently held an event where we vaccinated folks and actually incentivized with $100 gift cards, getting people vaccinated. And we had a large number of people that came out despite bad weather. We vaccinated 538 people, and that is a huge accomplishment for this community, because every person that we get vaccinated, we reduce their capability of transmitting the virus. We reduce their capability of spreading it to their family. We reduce their capability of going to the hospital. And a lot of folks have said, you know, why in the world would you spend money on that? Well, first, I think this is very important to understand. One, we're not spending any Dougherty County taxpayer dollars on this. We are spending funds from the American Rescue Plan. That's issue one. Secondly, I agree. I think it's sad that we have to, in many instances, or in these instances, actually pay people to literally get vaccinated. But that $100 is a very, very small price to pay in exchange for someone's life. It's also, just in terms of math, one day at the hospital costs a heck of a lot more than $100. Being on a ventilator for 2 weeks costs a heck of a lot more than $100. And so if we can convince and move people to make the right decision by making a contribution of $100 and helping them out with their lives so that they can make the right decision, not only for them, but for the people that they surround or that surround them, then I think that's a very small investment. And you're going to hear information in the next week or so about our next event. I really want us to get to 75%. We led the entire country when we were dealing with the first wave of COVID-19. We had to tackle problems faster, harder, and stronger than anyone else in the country. And we defined ourselves through that. We defined ourselves through 4 presidentially declared natural disasters occurring over the course of the past several years. We defined ourselves. And now, at the end of this marathon, we've unfortunately slowed our pace. But I want us to truly finish the race, finish the drill, and finish this marathon and do what we need to do in order to succeed, in order to make it so that we can experience life and connection in the ways that we should, so that we can go to family reunions, so that we can go to birthday parties, so that we can go and have dinner, so that we can do these things that allow us to act more free and allow us to communicate and connect with each other in the ways that are reasonable and safe and that don't require that there be an entire floor of Phoebe filled with people that are struggling to breathe. Thank you.
Thank you, Mr. Chairman, for your comments today. We will now move next to hear an update from our partners at Phoebe Putnam Memorial Hospital. Dr. James Black is here, who is the chairman of the emergency department. Dr. Black.
Good morning. Thank you. So overall, our COVID trend line continues to head in the right direction. We continue to have a sharp decline in the number of patients that we've had. But, you know, I want to pause the celebration. We still have 113 people in our hospital, in our health system this morning. And even though it's a decrease of 47% since our peak of 214, but it has been a decline of about 15% since last Friday. Today's total includes 89 at Phoebe, Maine, 23 at Sumter, and 1 at Sylvester. And we still have a high number of critical care patients, about 45, of which 29 of those are intubated. So we still, and 15 people have died over the last week, and that's still a very high number of deaths. That number has not slowed. So, you know, although the numbers are headed in the right direction, we're not out of the woods, and we're also waiting for another shoe to drop since we just passed the holiday weekend, wanting to, wanting to see how that's going to affect our upcoming numbers, whether or not we'll see a little bump in the numbers. Since July 15th, when the last surge began, we've admitted 871 patients. That average age has dropped to 56, with about 57% of patients actually being below the age of 60. We've treated lots of adolescent patients under the age of 20, many of them under 10, and had to hospitalize some here locally and transfer other kids out to pediatric specialty hospitals. The overwhelming majority of our hospitalized COVID patients continue to be unvaccinated. Okay, that number hovers around 88 to 92%, not only locally, but actually nationwide. So it's a big disparity in the course of the disease for those patients who are vaccinated versus those who are not. The research has shown that immunity can wane significantly in some vaccinated individuals 6 to 8 months after they're fully vaccinated. So we certainly expect the booster shots to be extremely effective at increasing and lengthening immunity. And that's been the big news, obviously, we've been following this past week. So I know it's been a little bit confusing about what's going to happen. I'll try to explain it, what was approved regarding boosters, and then Phoebe's plan going forward for booster shots. So this week, the FDA announced the third dose of the Pfizer vaccine for certain people. Those eligible groups include people who are at least 65 years of age, individuals 18 to 64 that are at high risk of severe COVID-19, and individuals 18 to 64 whose frequent exposure at work puts them at high risk of serious complications from the disease, and that includes healthcare workers and teachers. So vaccination administration Phoebe can't go just on FDA decision alone. We have to wait for guidance from the CDC and also from the state. So yesterday, the CDC advisory committees made some changes to the FDA plan that would have further limited the groups eligible to get the booster shots. But the CDC director, as we saw, overruled that recommendation and approved the FDA's plan. So here's where we are today. We're going to begin administering those booster shots after the state vets our plans, and we anticipate that'll be in the next week to 2 weeks. You probably remember the mass vaccination sites that Phoebe operated from January through May of this year, and our formatted process for booster shots will be very similar to that. We plan to open mass vaccination sites in Albany, Americus, and Sylvester, and we don't expect they'll be open for weeks on end, but we'll operate them as long as we deem necessary. And we'll provide all those details in the coming days and in the coming week, including location, hours of operation, who is actually eligible, and how we're going to schedule an appointment. So the booster program is going to be an important community effort to protect our vulnerable populations and vulnerable people from infection, help prevent new variants from taking hold in our area. So we're also asking for community help and support. Our resources are still stretched as we continue to respond to the current surge. We got great support during our initial mass vaccination effort, and we will need community volunteers to make the booster shot effort a success. So we're asking retired nurses or physicians who would like to help to sign up as inoculators. We're asking non-clinical volunteers that are also needed for tasks such as traffic control, greeting, cleaning chairs or sanitizing wipes, and other simple but important tasks. Anyone interested in volunteering will need to register through an online form, and you can do that by going to phoebehealth.com/coronavirus. That's phoebehealth.com/coronavirus. Once the schedules for the max vaccination sites are set, Phoebe will contact each volunteer to schedule their shifts. Again, this is an important community health effort, and I hope many of you will choose to volunteer to serve in some capacity. Even as we talk about the booster shots, though, it's important to stress that it's not too late for those who are unvaccinated to get your initial vaccination. You can schedule those vaccination appointments by calling 229-312-MyND. That's 312-6369. Of course, the vaccinations are still available through the health department, many pharmacies, and your healthcare physicians and other providers. We also have multiple mobile vaccination events coming up, including 4 tomorrow in Albany. Mobile wellness clinics will be at the Cray Chapel CME Church on Oak Haven from 9 to noon, at BJ's Country Buffet on Dawson Road from 11 to 1, at the Flint River Aquarium Water and Wings Wildlife Festival from 1 to 4, and at Deerfield Windsor School from 3 to 5. And appointments aren't necessary for you to go to the mobile events and get vaccinated. So if you haven't gotten vaccinated or you're making that decision, we urge you not to delay and take advantage of one of these efforts. Everybody stay safe, and thank you very much.
Okay, thank you, Dr. Black, for your update today. We'll now hear from the Department of Public Health. We have with us today Vermilla Lovett, who is the Director of the Dougherty County Health Department. Ms. Lovett.
Good morning. As of September 21st, 2021, 41% of the residents in Dougherty County were fully vaccinated, and 48% have had at least one dose. This is a total of 79,565 vaccines administered. In the state of Georgia, the fully vaccinated percentage was 46, and the percentage of those with at least one dose was 53%. And that's a total of 10,282,099 vaccines administered. At the Dougherty County Health Department, we offer all 3 vaccines, Pfizer, Moderna, and Johnson & Johnson, also known as Janssen & Janssen and J&J. These vaccines are available Mondays and Thursdays, 8 a.m. to 12 noon, and Tuesdays, 1 to 5 p.m. Appointments are encouraged, but they are not necessary because walk-ins are accepted. No one will be turned away during these hours who are eligible for a vaccine and want a vaccine. Beginning Monday, September 27th, 2021, the COVID-19 testing site will be located at 1150 West Oak Ridge Drive. That's 1150 West Oak Ridge Drive. That's a change from Phoebe North. Pre-registration is strongly encouraged. You can call 1-844-778-2455 or go online at the address shown on the screen here. Or we have a QR code that you can use while you're waiting in line. If you drive up and you don't have an appointment, you can actually use the QR code to actually go online and register. So when you get to the point where the testing is done, you'll be already registered and it can move the process along faster. As always, we're encouraging everyone to continue to be safe in our community. Remember to wash your hands. Do basic things like wash your hands, wear a mask, stay home if you're sick, and practice social distancing. And please, please, if you haven't been vaccinated, please reconsider and help us strive for 75. Reconsider and get the shot. Thank you so much.
Thank you, Ms. Lovett, for being with us today. We'll pause now for Any questions?
There's an easy
Okay. Hearing no questions today, would ask that you join us here next week at 10 a.m. on Friday for our Friday press briefing with updates on COVID-19. I want to again thank all of our citizens and those of you who came out to the incentive vaccination event behind the Civic Center. It was a terrific time there, and it was so good seeing all of our citizens, and we encourage you to be on the lookout for the next one, and again encourage others to look at the mission of Strive for 75. Do your part, reconsider, get the shot. That concludes our press conference for the day. Take care.
There's an easy way to protect yourself and those you love from COVID-19. Get vaccinated.
Here's what we know about the vaccines.
They're safe. Serious side effects are extremely rare.
They have one job. They kick your immune system into gear, then they leave your body.
They're effective. They provide outstanding protection against serious illness.
Listen to the local doctors you trust.
Let's strive for a 75% vaccination rate.
Do your part.